So quick public health update for today. There's more than 5.1 million cases of COVID-19 globally now, including more than 1.5 million cases in the United States. We are announcing an additional 81 New Hampshire residents with confirmed COVID-19 today, bringing the total to 4,014 people in New Hampshire who have been diagnosed with COVID-19 over the course of this outbreak in New Hampshire. There are an additional 15 people who have been hospitalized, bringing the total to 408 people now that have been hospitalized over the course of this outbreak in New Hampshire, and then 5 additional individuals, sadly, who have died from COVID-19, bringing the total to 204 people who have died from COVID-19 directly or because of complications related to COVID-19. 4 out of these 5 new individuals we're announcing today are or have been residents of long-term care facilities, which again I think highlights the burden that COVID-19 is placing on our more vulnerable populations in our long-term care facilities. So we've tested over 52,000 people for active COVID-19 infection. We're averaging over 2,000 PCR-based tests per day, so we're certainly ramping up testing to try and more rapidly identify infections so we can put people under isolation and quarantine and try and slow the spread of COVID-19 within our communities. Unfortunately, I also have I'm in the position today to announce our first identification of a New Hampshire resident with the multi-system inflammatory syndrome in children, which is abbreviated MIS-C, formerly and briefly called pediatric multi-system inflammatory syndrome. This was in a child under the age of 20 from Hillsborough County who was hospitalized with this syndrome with symptoms consistent with the national case criteria and the national case definition that has been recently created and put out by the Centers for Disease Control and Prevention so that we can start to identify children that are infected or affected by this syndrome so we can learn more about the way that this presents in some of our younger population and why some people and some children may be at risk for this and others are not. So we will be working with the CDC to investigate patients with this multi-system inflammatory syndrome in children. As I'm sure many of you are aware, we put out a Health Alert Network message a week ago to healthcare providers asking for increased vigilance and reporting to public health so that we can more rapidly identify and work with the CDC to investigate these types of cases so we can learn more about what causes it and what the underlying risk factors are. I just want to mention that to date we've had about 200 children under the age of 20 confirmed with COVID-19 in New Hampshire. That's about 5% of all the confirmed COVID-19 cases. Only about 3% of all of these children under the age of 20 have required hospitalization. Thankfully, no deaths. So we do believe that severe illness in children requiring hospitalization, and MIS-C, this multi-system inflammatory syndrome in children, is uncommon. But again, we're still learning about this virus as it spreads around the globe. And so hopefully there will be more information coming on this new syndrome as we work with other states and the Centers for Disease Control and Prevention to investigate. We still believe that a majority of people will only develop mild symptoms when infected with this novel coronavirus that causes COVID-19, but we do want everybody who is symptomatic to look for testing so that we can rapidly identify and help prevent spread of COVID-19 within our communities. There's various options for testing that are out there. But I also want to stress that testing is only one tool to help limit and prevent the spread of COVID-19 in our communities. And so we need to be continuing with social distancing when we are out in public places. We continue to recommend cloth face coverings for people when they are in public places. You'll see cloth face coverings incorporated into much of the reopening guidance that is now online. Again, a cloth face mask or a cloth face covering is intended to protect other people surrounding the person wearing the cloth face mask to prevent transmission and spread or other people from coming into contact with the person's respiratory droplets. And so we encourage cloth face mask use when people are in public places, in businesses where social distancing may be difficult. We will continue to provide updated and helpful information as this outbreak unfolds. And I think that this unfortunate announcement of the new resident with multisystem inflammatory syndrome in children is unfortunate, but not unexpected as we look more for the syndrome. Thankfully, let me say that I believe this person, last report that we've had, is hospitalized but recovering, and so that is some potential good news. Thank you.
Thank you. Just a quick update on a couple of areas. So our recovered numbers, you'll see that we had a significant jump in our recovered numbers over the last couple of days. What that really relates to is, if you'll notice, 2 or 3 weeks ago we had a lot of high numbers in our daily case counts, so a lot of good follow-up with those clients this week. And our recovery system remains a very manual process, so a lot of times we do batch reporting when it comes to recovery. So a lot of people asking questions about what's going on with the recovery numbers, and that's what's going on. Just an update on long-term care. We have 2 new facility outbreaks to announce today. Bedford Nursing and Rehab Center, and they have 13 residents and 4 staff. And Greystone Farm at Salem, and they have 5 residents and 4 staff. Please know that these numbers are they're not always exactly the same as the numbers that the facilities have. So if you are a staff member in a facility, or you have a family member in one of those facilities, and you can say, well, we know that they have more cases than that, or 1 or 2 more or 3 more. A lot of times it takes a day or 2 for us to get the test result back and then do that case investigation. So it doesn't enter into our case counts for a day or 2 after the facility receives it, because we need to do that contact investigation. So that's really important. The nursing home testing project, all the nursing home test kits have been sent. Over the next several days, we should receive the remainder, and at that point, we will have received specimen collection for all nursing home residents across the state. In addition, looking at our latest numbers for long-term care staff tested, since the beginning of COVID-19, we have tested approximately 8,000 long-term care staff members in the state of New Hampshire. As Dr. Chan said, we're averaging a little over 2,100 tests per day for PCR testing and over 550 tests per day for antibody testing. Our expanding testing criteria starts on Monday. That includes household family members of vulnerable citizens and child care workers in child care centers. Hopefully, coming next week, we will have some additional guidance to help our business partners as they get back to work, and we see more types of businesses reopen. That's all I have. Thank you.